Well, the Department of Health has urged South Africans to vaccinate, get their boosters and observe non-pharmaceutical interventions. This after the first case of a new highly transmissible variant of the coronavirus. The World Health Organization says XBB.1.5 is the most transmissible subvariant detected so far. Now, let's discuss this. We're now joined via Zoom by Virologist Prof Barry Schoub. Prof, thank you so much always for your time. How much do we know about this XBB.1.5 variant, and just how concerned should we be in the country?
Yes, good afternoon, Anati. Thanks very much, and good afternoon to your visitors, to your viewers. Yeah, this is not a new. It's not a new virus. This is a subvariant of Omicron. Omicron we've had for some time already. That's not new. This is a virus which does mutate. It changes very readily. And as it picks up mutations, it can change its properties. And this is actually what's happened. It's engendered a new mutation in a particular site, giving it a great growth advantage. So this particular subvariant, this XBB.1.5, does grow very rapidly. And because it grows very rapidly, that's in effect, clinically, it spreads very, very easy. It's much more transmissible. So it was first detected in the United States, and it's northeastern the United States, and there it spread very, very rapidly. It started off there at 1% of the isolates, and it's now over 70% in the northeastern United States. It spread rapidly. As far as we're concerned, we've had Omicron for a number of months now. It's not totally new. And we've had, in fact, there are now hundreds of these subvariants. This latest one is one we need to observe because it is highly transmissible, but there's no evidence as yet that it does cause more severe disease. So we do need to be vigilant. We do need to have good surveillance, but we don't have evidence of it causing more severe disease. So really, at the moment, it's not cause for concern. It's certainly not cause for alarm.
I would imagine that the reason that some South Africans say there is a cause for concern is because, as you rightfully say, that it is highly transmissible. So the question then is, how effective then are our current vaccines against this variant, particularly because we are hearing from experts that it's not very different from previous variants, apart from the fact that it is highly transmissible?
Yeah, thanks, Noah. That's a very good question. As far as we know, the vaccine is still very protective, particularly against severe disease, against this particular subvariant. There's no evidence that the vaccine is going to have any reduced or any significant reduced efficacy. And also, you must remember, in South Africa, we are to some extent fortunate that we have a very high level of immunity in our population. And this immunity will probably protect to a very large extent against severe disease. So we do have COVID, as we know, at a low level, as was just reported, at, I guess, an endemic level. And I guess this new variant will be part of it. But the important thing is, as you mentioned, I think it's important to stress it to the viewers, that it is important to be up to date with vaccination, and to at least have particularly the high-risk individuals, people that are either elderly or have underlying medical conditions which make them vulnerable to the more severe disease, to be up to date with their vaccination. At least 3 doses, and if you're in a high-risk category, 4 doses of vaccine. You must try and get, I think that's the most important message which needs to go across.
I mean, it is comforting to know, as you say, that, in this country, we have a high population immunity, which is good because it then will prevent, from high, disease, if at all possible, that it becomes dominant here in this country. But let's just talk about the dominance, in the strain. We know that, for instance, that it has become very quickly dominant in the US, and I believe it's also detected in at least 28 other countries. Is it likely to be dominant in South Africa? And in that case, because of our high immunity rate in this country, will we then be prevented from becoming very ill, as you say, if it does become dominant?
Yeah, I think, as you say, it's not surprising that it has spread to South Africa. It really was a matter of time because it's spread in fact, it's now, I think, 37 countries around the world, and it probably will go right around the world, including South Africa. So it will be one of the subvariants, but I say we've got many subvariants which are circulating in the country. As it stands at the moment, we're fortunately still in our summer season, so these respiratory viruses don't spread as readily, and this, of course, will be one of them, as in the winter season. And also, a high level of immunity will probably also be protective against severe disease. We will get more isolates, there's no doubt about it, but I think it's very unlikely that it's going to cause a serious public health problem.
So it's very unlikely that we will see scenes of previous years where we would have to then again reinforce, just those measures that were taken during the hard lockdown, as an example.
Yeah, I think it's unlikely that this particular subvariant will cause a hard lockdown or any lockdown or any increase in restrictions. Having said that, of course, this is a very mysterious virus. It's a virus which does mutate readily. If there's a new variant, remember this XBB.1.5 is a subvariant of Omicron. Omicron is saying we've really gotten used to. But if a new variant arises, I think it's unlikely, but certainly it's possible. Then, of course, that's a different story. Then we may need to kind of examine the situation very critically and apply the various public health measures which may be necessary. Let me say that's unlikely, but we still need to be vigilant. We need to have our surveillance systems going to be able to detect that as early as possible.
Should the country, at this stage, Prof, as we wrap the conversation, at least from the health department perspective, open up or start, the drives again where they encourage people to vaccinate? Because I am seeing a wane in that front, in that some people don't even know where to go now, to get their boosters, as an example, because there was that high intensity drive, but we're not seeing that anymore.
Yeah, this is a big problem, Inati, that there's been a sharp drop-off in people going to vaccination sites. And this is why many of the vaccination sites have actually closed down. So if people want to know where to get vaccinated, they must go to the Department of Health website or to the hotline and see where there are vaccination sites open. I think it's very important. As you mentioned, the vaccination level has dropped quite markedly. And in fact, we're particularly concerned with the high-risk individuals in the elderly group. For example, it appears that about a third of people over the age of 60 have not completed their vaccination. Now, of course, they may well be vulnerable to severe infection should they pick up either this or other subvariants. So I think that's the main message: get vaccinated, get fully vaccinated.
Thank you so much, Prof. Always a pleasure to have you on the show. Professor Barry Schoub there is a virologist.
Thank you.
Of course, the public encouraged there to continue to vaccinate and obviously follow, the social distancing and mask up, because as you heard in that previous clip that we played, COVID-19 is still around in the country. And as we head to winter in a couple of months, people should adhere those health rules.